Ladies, are you dealing with signs of low progesterone like insomnia? You just can't sleep or you can't stay asleep. Your cycles are all over the place, or you're not even having a cycle, or you're having things like mood swings, anxiety, depression, or even things like headaches and migraines. The number one reason that you're having low progesterone in most cases is not because you're not producing enough progesterone, which we'll talk about how that is produced in the body, but it's usually because you're converting progesterone into other hormones. See, we have to understand that progesterone is not an end stage hormone. It converts down into mainly cortisol, but it can also convert into estrogens. It can convert into aldosterone, right? But why is the body converting the progesterone into those other hormones? That's what we need to figure out, because there's stress on the body. Let's talk about cortisol. Cortisol is a stress hormone, and the number one reason why women are low in progesterone is because you're converting it down into cortisol. So what is stressing out your body? And most women only associate stress with emotional stressors, but there's also physical stressors and chemical stressors. These are things that we need to address in order for you to maintain normal progesterone levels. Now, how is progesterone made in the body? So inside of your ovaries, as your follicle matures, this is when you're actively menstruating. Then you go through the ovulation process. So your body releases that egg, the follicle releases the egg, and now that follicle inside of the ovary turns into what's called the corpus luteum. As the corpus luteum matures, that's what creates the progesterone spike and the production of the progesterone. And so absolutely making sure through proper testing. I love the Dutch test. The Dutch test is done through Precision Analytical. We run that on many patients to really look at not just hormone levels, but also the pathways. So hormones are produced by the body, and then they need to be detoxed out. So they're converted into different metabolites, and then they're converted out of the body. This can all be seen through the Dutch test. So the big question is, why do you have low progesterone? Because in most cases, when you go to the doc and you're low on progesterone, they're just going to give you progesterone. But if you're converting the progesterone into other hormones, and those other hormones can be inflammatory, what sense does it make to just give the body more progesterone? See, here at The Wellness Way, we don't guess, we test. We want to figure out why you're having low progesterone, not just give you the hormone that you're deficient in. This goes the same with testosterone, estradiol, progesterone. When you go to the conventionally trained doctor, if you're low in a hormone, then they're just going to give you more of that hormone. We need to figure out why. Guys, like and follow this page for more information on hormone support.